Have you ever wondered knowing what are anxiety disorders? To know exactly what it is, watch this video till the end. Anxiety disorders are serious mental illnesses that cause significant worry or fear that doesn't go away and may even get worse over time. We all feel anxious at times, but with an anxiety disorder, the anxiety tends to be fairly constant and has a very negative and intrusive impact on a person's quality of life. Types of anxiety disorders. There are several types of anxiety disorders, including generalized anxiety disorder, obsessive-compulsive disorder, panic disorder, post-traumatic stress disorder, social anxiety disorder, specific phobias. The 5th edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, breaks anxiety disorders into 3 categories. Anxiety disorders, obsessive-compulsive and related disorders, trauma and stressor-related disorders. This differentiation shows that while the disorders have a commonality and are related, they are distinctly different as well. Anxiety disorder symptoms. Anxiety disorders come with a whole host of symptoms and no one person has the same experience. Each disorder tends to have different symptoms as well. The symptoms common to anxiety disorders in general include difficulty sleeping, dizziness, dry mouth, feelings of nervousness, panic, fear, and unease, muscle tightness, nausea, rapid or irregular heartbeat, sweaty or cold hands and/or feet, tingling or numbness in the hands or feet, unable to be calm or hold still. When you experience the familiar physical and psychological signs of fear and anxiety such as sweating, racing heart, shortness of breath, trembling, worry, or stress, these are cues that something is happening that could be a threat and that you need to deal with it. This flight or fight reaction activates the physical and psychological resources necessary to deal with the potential danger. Although this system works well most of the time, sometimes it can go into overdrive and do more harm than good. When this happens, it might indicate you have an anxiety disorder. Causes. No one knows exactly what causes anxiety disorders, although there seems to be a variety of factors, including genetics, environment, stress level, brain changes, and trauma. Researchers are discovering more about these links all the time. Millions of adults will experience an anxiety disorder at some point in their lives. Because women are twice as likely as men to experience anxiety disorders, experts recommend that women and girls over the age of 13 should be screened for anxiety during routine health exams. Diagnosis. There are no lab tests that can be done in order to diagnose an anxiety disorder, though your doctor may perform some tests to rule out physical problems. Your doctor may refer you to a mental health professional, such as a psychiatrist, a psychologist, or a counselor, who will use specific diagnostic tools and questions to help determine what sort of disorder you may have.